I first got really interested in how housing affected health as an intern. I was straight out of medical school and I had started practicing at what was then Boston City Hospital. And I admitted a child to the ICU, the pediatric ICU with asthma. And I was struck because she had had previously pretty well-controlled asthma, and we were sitting there trying to talk with her family. What was different? Why did she end up in the ICU? And it became clear that one of the new changes in the house was that they got a cat. And as many of the people in the audience will say, well, why would you get a cat? And in this case, I actually knew she was allergic to cats. I had read her allergy profile. And it turned out that the family had mice. They had actually found a mouse in her bed. And so this family was left with this incredible devil's choice where they had this awful problem and they made a choice to make it better. And that choice probably ended up in this really bad adverse health. And all I could think about was, no amount of medicine I was going to give this child was going to make it safe to send this kid back to that environment, that the prescription I wanted to write was a healthy home. And so that what I've started thinking more and more about is housing is a vital sign. Like when we go to the doctor, they take your height, they take your weight, they do a blood pressure check, they may take your temperature. And why do we do those vital signs? Why do we view them as essential to the pediatric or the medical practice? Is because they're essential to health, to our understanding of health and its consequences. And housing should be a vital sign. We know there are simple questions that we've tested in our Children's Health Watch, simple things like asking about overcrowding, asking about how frequently you're moving. Because what we know is if you're moving 2 or more times in a year, you are much more likely to have bad health outcomes, to be at developmental risk, to not be growing your brain. And so that when we think about that, I more and more think that there are simple ways that we can integrate into healthcare our understanding of housing and that idea of a stable, decent, affordable home as being the medical intervention that we want to give, being the vaccine that we want to deliver, is what we need to start thinking about more and more. And I'm really wanting to more and more make sure that healthcare is part of that conversation. When we're trying to talk about how home matters, healthcare needs to be part of that conversation.